Sitaram, and welcome to this program, Addiction and Recovery. I'm your host, Ram Naresh Dwarika. I want to welcome all those people listening in Trinidad and Tobago, up the Caribbean, and worldwide on the various media platforms, and to remind our listeners, our brothers and sisters out there, that this is an interactive program. You can call the station at 663-2335 or 663-1027, or you can text me at 768-5925. And if you have any brief comments or questions, I will try to address them. Again, this program is recorded and will be posted on YouTube and Facebook a few minutes after the end of the program, so that those of you who do not have the time to listen to it now, you can come back or you can refer it. Send a link to someone who you believe might benefit from this program. The program will also be repeated on radio and TV Jagriti at 10 p.m. tonight, so you can listen to it again. As I said earlier on, this is an interactive program, so of course you can call in while it's live. This morning, there's so many things I would like to address. During the week, I've had many questions. Some of those difficult situations that family members find themselves in. And, I will want to speak about how do you select an appropriate program, whether you be the person with the problem or whether you are a relative who has a sibling or a child, and you want to see what are some of the factors that one should consider in selecting the appropriate program for recovery. Well, in the past programs, we have discussed the difficulty in getting the alcoholic or the drug addict to agree to seek help. For the individual themselves, that is a challenge. Because of being a person in recovery, I postponed that, I rationalized that for years. I did not want to go anywhere and let anyone know I had a problem with drinking or drug use. And I assume and I know that a lot of people have that same problem. And so that the whole question is, there's a question of denial, but eventually the individual will have, and if you having to choose a program that you would go to, a lot of people will prefer to go to somewhere where it is confidential. So that, a lot of people choose as their first line of defense, they'll go to their primary care doctor with their problem, because alcoholism is a disease that has so many other branches to it. It will present in so many different ways. A person might fall down and break an arm under the influence, get into a vehicle accident, or they may start suffering with liver problems, immunity diseases, because when you're drinking, you don't take care of yourself, you don't eat properly, no exercise, no rest, dental problems develop, and of course, any one of these things could take you to your doctor. And one of the first things in my experience, because I have worked at all the hospitals in Trinidad, I've worked at Port of Spain, St. Anne's, Cora, San Fernando, Cuba hospitals, and I've seen what happens there. A lot of people will show up to a medical professional presenting with the withdrawal symptoms. One of the classic withdrawal symptoms of alcohol use and abuse is insomnia, because alcohol is a sedative. And so a lot of people become dependent on alcohol to help them to sleep. So they'll go to the doctor, and the first thing they'll tell the doctor, well, look, doc, I'm having a problem, whatever they're presenting with, maybe the fever and the cough or whatever they might have picked up, but somewhere along the discussion comes up the whole question, well, I have not been sleeping well. And the doctor will prescribe a sedative. There's a whole list of sedatives. I'm not really going to call in names of them because I don't want to advertise these things. But once you get put on these little small blue pills and white pills that make you feel sleepy, these substitute for the drug. And they're much more likely for you to become dependent on those because they are measured. They have a half-life. You know, by the time one wearing off, you're already prescribed in your prescription to take one before the effect of the last one wear off. So there's a buildup in your system. And I know it is several times more difficult for people to come off prescription medication, sleeping pills in particular, anti-anxiolytics, tranquilizers, than it is to come off illicit drugs, alcohol and cocaine and marijuana. So I'm not blaming the doctors, but any doctor who prescribe, in fact, in the ethics of the profession, I understand from working in the fraternity that, psychotropic drugs should really only be prescribed by psychiatrists. But I know that the general practitioners, they prescribe it as well. And the pharmacies, some of them even sell you that without prescription. And I know that I'm not blaming all the pharmacists in Trinidad, but I have people who reported to me that they could go and get certain drugs under the counter or over the counter, as we say. So that's the first line of defense. A lot of people go to their family doctor, and a lot of family doctors, of course, would have recognized the problem of alcoholism and suggest. And so that I know a lot of uh, patients presenting with alcohol dependency and alcohol related illnesses and problems, they are referred to Alcoholics Anonymous, some of them, some of them even from workplaces. I remember in the old days when Carney Limited was in operation in the Felicity area where I live, the overseer there, he was aware of the meetings and he would send people to the AA meetings and insist that they bring a letter of accreditation that they attended. So you have the professional that you can go to. Yes, it is more confidential, and these are professionals. You have people who are psychiatrists, doctors, and then you have people like myself who are counselors and psychotherapists. They are psychologists as well in private practice. So those will be one of the options that a lot of people will opt for initially. Go to speak to somebody one-on-one. That is after they have probably struggled with it for many years to try to see if they could deal with it. And then eventually, even when I counsel alcoholics and drug addicts, I strongly suggest that they go to the Alcoholics Anonymous meetings or the Narcotics Anonymous meetings because these support groups are free and they are located in a lot of the communities, very near, easy access. And now, since the COVID, it is even better. A lot of people there are meetings that are kept online, and I'm seeing a lot of women and young women in particular going to these meetings online and staying sober. This is really, one of the good things that has come out of that pandemic is the fact that now we have the Zoom platform that is being used. And in fact, this program now is being presented on that Zoom platform and recorded and will be presented on Facebook as a resource. So that a lot of good has come out of this. I don't have to go physically to the radio and television station anymore. I can stay in my office here, which gives me more time to attend to my patients and so on, and still be able to do this program once a week. So first, a lot of people can go to their primary care doctor, but please, if you're prescribed medication, a barbiturate, a sleeping pill, that must be only a temporary measure. No one should have to take any pill for the rest of their life, especially for lifestyle illnesses. They should find some way to eat the right thing, exercise, rest, maintain the right attitude, so they don't have to become dependent on these pills. So your first line is your primary care doctor, your psychologist, your counselor in the area. And then you can go to your AA meetings. And anyone who would like to get the information regarding AA meetings and so on, you can call me after the program and I would be happy to give you that information. If you'd like to access an online meeting, there are online meetings every night in Trinidad and Tobago and worldwide. You have a choice of going to a meeting in Australia, New Zealand, England, South Africa, depending on the time zone. And that is also available. Now, in addition to that, we have governmental and non-governmental agencies that treat with the whole problem of alcoholism and drug addiction. There is the National Drug Treatment Center, which is at the Substance Abuse Prevention and Treatment Center at Cowra Hospital, and their clinic is on Thursdays from 8 in the morning. You go, if you have a referral from your primary care doctor, that would be a help. It helps the person doing the assessment, the social worker, or the doctor. But when I work there, I know you can go even without a referral. You just go and they will see you and they will make a file and make a determination as to whether you should go into the inpatient program or the outpatient program. There are two programs. There's an inpatient program of 6 weeks at Cowra, and there's an outpatient program that you can stay at home, you can stay at work, and you can come and attend once a week. So there is that. And then you have several other non-governmental organizations, like the New Life Ministries. They are located at Mount St. Benedict. They also have a branch now in Santa Flora, especially for female addicts and alcoholics. Then there's Rebirth House, which is located at Charlotte. The head office is at Charlotte Street in Port of Spain. You can get the numbers of these for these places in your national directory. There is also the Heal House, which is located at Presal Village in central Trinidad. That was originally sponsored by Carney Limited, but it's still being run by a little group there. I have to say kudos to them. And then there's the Serenity place that I've spoken about, and you would have heard in the past. Their manager is Miss Beverly Mawson, and that is a center for female alcoholics and drug addicts. They are located at Cochrane Village near Point Fortin, South Trinidad. And of course, you can get in touch with them if you would like to get someone in there. So I will stop here. We'll take a little break. And when I come back, we'll continue to look at the various options. What are the suitable options available to people in Trinidad and Tobago if they have a problem with alcohol or drugs? So hang on and come back in a few minutes.